afternoon, and thank you for taking the time to hear my story. My name is Meighen Lovelace. I'm on the Safety Net Subcommittee in the Behavioral Health Task Force. I also serve as the president of the Federation for Families for Children's Mental Health. I sit on the Pediatric Mental Health Institute's Family Advisory Council for Children's Hospital. I'm also on the governing council for the Colorado Blueprint End Hunger, as well as the Alliance to End Hunger's International Advisory Board. I start there because, like Fernando, my story gets a little different from here on out. My daughter expressed some questioning behaviors from a very early age, and I have to thank Early Childhood Partners from the bottom of my heart for coming into partnership with myself and my family at an early age to help navigate that situation with my daughter. We thought we had it all on lockdown. I took the Incredible Years class about 20 times. I practiced at home, but it wasn't getting better. And in kindergarten, she was suspended several times. Once put into the janitor's closet because everyone was afraid for their safety. Thank goodness the janitor took her out and gave her a hug because that's what she truly needed. The school she goes to is amazing, and the support she gets there is incredible, but they're working with very little. As you said, over the summer, there's not much for us. A few years ago, she was participating in summer programming through Youth Power 365. The teacher called me and said, "Come get her. This is above my pay grade." That teacher is now the counselor at our school. Youth Power 365 denied my daughter's services for liability reasons. A few weeks later, right here in this building, my daughter was denied services, again for liability reasons. After being rejected by her community, she looked at me one evening and she said, "Mom, I don't want to be alive anymore and I'm going to get out of my body." She attempted suicide then. We took her to hospital. They took her to Children's Hospital and put her inpatient. From there, nobody knew what to do because we were told by Children's Hospital we lived in a resource desert, and they could not, in fact, send her home because there was nothing here that could help her. We were asked to use our community behavioral health center. They didn't return phone calls. They recommended a psychiatrist to us while in the hospital that was actually her psychiatrist, who we couldn't get in touch with. We had to take her off her medicine without a psychiatrist because nobody answered the phone. When we did come back, we were told that we would have to use what was here, and there wasn't much. After 7 months, we were able to get a single case agreement. Our therapist is amazing. It shouldn't have taken 7 months. It's been years with a single case agreement with a therapist, not working under parity. Every single time she fills out her forms, they send them back and tell her they're wrong. If her therapist wasn't an angel from heaven, I'm sure she would have quit by now. But still, she didn't have what she needed. And again, she told me last summer, without the stability of school, without any interventions, because now we can't participate in community programming due to liability, she told me again, "I want to get out of my body." But this time, before she tried, because of the skills she's building, she said, "Mom, my voices are telling me to stab myself. I don't want to. I need help. Take me to the hospital." And I took her. And the social worker said, "There's no such thing as children hearing voices." They put her on an M1 hold, shipped her off to Cedar Springs, 5 hours away from us. And there's roommates there. Did you know that? Her roommate beat her up every day. They refused to change the room. They said it was their decision, not mine. At some point, locked me in the visitation room with other psychiatric patients with no supervision. I watched children walk out in handcuffs every day from Cedar Springs when I was visiting. It was 5 hours away and the Ronald McDonald House was closed. I couldn't leave my baby, so I slept in my car. They also called Child Protective Services on me and reported me for medical neglect. My family was then investigated by a case manager who said, "My job is to investigate you for not properly caring for your daughter." It wasn't the help we needed. When they took my children off for the interview, I don't know what happened, but when they came back, my children said, "Mom, do we have to go live in a different house? We don't want to leave you." What we know now is that we can't reach out in our own community for support. It's not safe. If the answer is to call Child Protective Services, then I'm not calling for help for my family. Where is home? We live here, but we're invisible because we're too scary to be seen by the folks in leadership that just don't know what to do with a kiddo like mine and a family like mine. So, because my kids go to school just down there, because we live here, and this should be our home, please stop asking us to move. Stop telling us that this just isn't our home because there's not the resources here for her, for us. Welcome us in and problem solve with us. We don't want to be seen as the enemy. We don't want to be isolated. We want to feel like we belong. And so does every other young person with a mental health illness. Don't be afraid of them. All they want to do is feel as though they have a home. Thank you for hearing me today.
Thank you. Thanks, Meighen.